Welcome to the Sports Med Minute, a conversation with local physicians in the northern Michigan area on a wide range of healthcare topics. My name is Jeff Saman. I'm a physical therapist at Northern Michigan Sports Medicine Center. Today we're sitting with Dr. Eugene Wang. Dr. Wang is a specialist in physical medicine and rehabilitation. And Dr. Wang, thanks for taking the time to meet with us.
You're welcome.
Can you tell us a little bit about your specialty and your practice?
Yeah, I am a physiatrist or physical medicine rehabilitation specialist, and I subspecialize in spine and sports medicine, particularly interventional procedures regarding the spine and joints. So basically, achy backs and achy joints is my business.
Okay, good. And business is good, I assume?
It's always good.
Yeah, everybody's had those
unfortunately.
issues. So let's say that I go out after the next snowstorm and I'm shoveling snow. It's been about 20 minutes. And all of a sudden I feel this sharp stabbing pain in the right side of my low back.
Mm-hmm.
What are some things that could be?
There could be numerous things that could cause that. And the most common include strain in the lumbar muscles or ligaments, or it could involve kind of throwing your back out of alignment or your pelvis out of alignment. That's certainly a possibility, or more serious issues with disc herniations and other similar pathology or problems.
So if somebody does have that type of problem, again, I'm out shoveling and I get that pain,
Right.
what should I do?
You know, in the first 24 hours, it's really crucial to kind of lay low and stay low key there, and ice the area. Not use heat, but use ice for the first 24 hours, and that reduces the inflammation or swelling in the area. Also helpful would be using some naproxen or Advil or something over the counter. That's some kind of anti-inflammatory medication that would again decrease the swelling in the area, and usually that should help a lot.
Okay. Now my grandma always used to tell me that what you need to do for a back injury is go on bed rest for a week. Is that still the prevailing thought, or what do people normally recommend for activity?
Actually, that's not the prevailing thought. People should not spend more than 1 or 2 days at most on bed rest. And actually, studies have shown that prolonged bed rest actually worsens the outcome of these injuries or lengthens the time it takes to recover. So bed rest will result in deconditioning of the muscles and supporting structures. And so really gradual return to activity is probably the best advice.
Okay, great. All right, so let's say that I've gone through all that. I've done the rest for a day or two. I've done the ice like you recommended. I've been taking Motrin for a few days. Let's say it's been about 10 to 15 days or so, and I'm just not getting better. What should I do at that point?
Usually the first step is to go see your family doctor, and I think our family doctors, especially in this area, are very astute in managing these types of problems. And based on how serious the issue is, they may handle it themselves, or they may refer to a practice like myself.
Okay, so once that person goes to the doctor, what should they expect during their appointment? What kind of things is a doctor going to want to look at? What is he going to ask the person?
Well, they'll probably ask how it happened and how long it's been going, if the symptoms have changed in nature or not, if there's any pain radiating elsewhere into the extremities or other places, what makes it better, what makes it worse, those kinds of questions. And they may order some X-rays or other imaging studies to evaluate for deeper injuries.
Mm-hmm. So a lot of patients at that point, they're going to get referred to physical therapy first. Start some exercise, try and get them moving again. Let's say that again this person has gone through their therapy. If they're not seeing the kind of improvements they would expect to see, they go back to see their doctor, and their doctor says, you really should go see Dr. Wang to take care of this. What are some things that you might do for that person?
Depending on what's the cause of the problem, my first priority would be to find out what's causing the problem. So depending on what that is would determine what the treatment regimen would be. But say, for instance, if it was a joint problem and maybe some manipulation could put it back into place, or if it's a continued irritation and the alignment was okay, I can actually use X-ray guidance to guide a needle into the facet joint and inject the joint with some steroid numbing medication to calm down that pain. or if it was a pinched nerve or something else causing sciatica, we could do an epidural block to calm down the inflammation or swelling in the nerve.
So it sounds like for your interventions, just like we do in physical therapy, the goal is not to just throw some things at the problem and try and mask the symptoms. We're really trying to figure out what's causing that problem. And it sounds like what you're describing is a very precise, exacting procedure.
Right, there's no guesswork. I mean, as much as we can handle it, there's no guesswork involved. We try to be precise with what our diagnosis is and then treat the problem precisely with guided injection procedures and or other types of treatments.
Okay, great. All right, thanks for taking the time to meet with us.
No
I
problem.
appreciate it. This has been the Sports Medicine Minute. I'd like to thank Dr. Eugene Wang for sitting down with us today. Dr. Wang, it's been a great conversation.
Thanks.